All right. So in the last 24-hour reporting period, there's been 252 new cases of people with COVID across the GV Health's local public health unit area. Across those specific areas, 71 people in Shepparton, 37 in Moira, 71 in Mitchell Shire as well. So we're now at 2,722 active cases across our local public health unit, and 581 in Mitchell, 468 in Moira, over 100 now in Benalla, just over, and 1,168 cases in Shepparton. There's been a bit of a shift in the age profile, so across the Christmas New Year period and into the early part of January, we were seeing around about up to 50% on certain days, but certainly in that 40 to 50% range of people with COVID who were aged 20 to 29 years, but now it's levelled out a little bit, so 16% of those active cases are people aged 10 to 19, 27% aged 20 to 29, and 16% aged 30 to 39 as well. So, which is probably what we expected after people were moving around a lot in the Christmas and New Year period. So pleasingly, that's the third day now we've had case numbers in the order of around about 250, give or take, which is an encouraging trend in terms of starting to see those numbers plateau. However, just based on the sheer amount of COVID that's in the community, I don't want people to become complacent and put off getting tested and us leading into scenarios where COVID is still spreading pretty quickly across the community in coming days. So for anyone who has symptoms of COVID-19, we really want you to get tested straight away and not put it off, and get tested as soon as those symptoms start. And of course, anyone who's a household contact or a contact of any nature should get tested. There's plenty of access now to testing for people who are in that category of being symptomatic or who are a close contact. So it's really important that people come forward and get tested straight away. There's good access to rapid antigen tests and also to PCR tests as well. In the coming days, in fact, from this morning, we've had to make some changes to where our testing locations and vaccination services will be provided in the coming couple of days, and that's because of the Spring Nats Car Festival that commences this weekend at the Shepparton Showground site. So all of the details that I'll run through now will be available on, and already are available on GV Health's Facebook page, and we'll continue to put updates regularly in there. This morning we relocated the drive-through testing site from the Shepparton Showgrounds to the Sports Precinct at 120 New Merker Road in Shepparton. That is, as I said, both a drive-through site. It is a drive-through site for rapid antigen tests and PCR tests as well. That site's open to 3:15 today and tomorrow from 7:15 to 3:15 p.m. and right across the weekend as well. The respiratory clinic here at Graham Street will continue to be open from 8 till 4 p.m. The other thing just to encourage people to note is that, of course, if you do have a positive RAT test, you do need to report that. It is a public health order that's been issued in Victoria by the Minister for Health. So there is an online portal at the Department of Health's coronavirus.vic.gov.au website, or you can also register that by phone at 1800 675 938. In terms of vaccination, also again some changes we've had to make because of the Spring Nats Festival. And I should just add in terms of when we worked with Council, who have continued to be terrific supports to the work we're doing more broadly, that is across the community. City of Greater Shepparton's been terrific in terms of enabling us access to a range of their sites. But when we agreed that we would go ahead with the Spring Nats Festival, the circumstances at that point were well and truly different to what we are now. But as we've been right throughout the pandemic, we'll continue to be flexible and adjust accordingly. So in terms of vaccination, the vaccination clinic at the Hub will be open from 9 a.m. to 12 p.m. tomorrow, and then reopen at 1 p.m. on Monday through to 5 p.m. We will also now, we've been able to successfully recruit some additional staff in the order of about 10 to 15 people in the last 1 or 2 weeks. We can now start to open some additional times that we will be offering testing, particularly focused at the 5 to 11-year-old program. So next Wednesday on Australia Day, we'll be open from 9 to 5 p.m. And then also the following Saturday, the 29th of January, will be open from 9 to 5 p.m. So we're really, as we get more people into the vaccination team and trained up, we're just trying to increase and open up as much vaccination slots as possible. We are expecting to see an increased demand for vaccination in the coming few weeks, and that's of course due to the 5 to 11-year-old program, but there's 2 other key things that are driving that demand. We have some looming deadlines in relation to the requirements for all healthcare workers, aged care workers as well, to have their booster shots. That first tranche of that is on the 15th of February, so it's not that far away. And also in terms of the changes in relation to the eligibility for booster doses. So we're working really hard, as I said a few minutes ago, to recruit additional staff. However, we're really happy if there are more people who'd love to come and work in our vaccination team. We'd love to have you. So gvhealth.org.au, you'll be able to find a link to our recruitment page there if you're interested in not only, of course, giving the vaccinations, and there are a broader scope for people who are studying a health-related career or recently retired from a health career. They can come back in and work to provide and actually give the injections, but we also do need some administration and support staff, pharmacists as well, to help with preparing the vaccinations. At the moment we are still taking bookings only, and that's just as we open up more appointments, it's a much better way for us to manage the demand and give people certainty for their vaccinations. So again, coronavirus.vic.gov.au is the best place to search for that. In terms of the Code Brown situation, as we talked about earlier in the week, we've now in a full and active Code Brown situation as part of the statewide declaration by the Department of Health. We commenced moved across from the sub-incident management arrangements we had in place earlier in the week and in the last few weeks to the now active Code Brown scenario. We have, some of the things that have changed is a slight movement in terms for us. We did have a semi-incident management team already operating, but that's now formal and stood up and operating effectively. In terms of the impact on our services from a day-to-day point of view, at the moment as of this morning, had 21 patients admitted for COVID at GV Health. 2 of those people are in critical care, and either of those 2 people aren't ventilated either. So the Code Brown is, as I said, it's continuing to enable us to manage our resources to meet the priority areas for the community in terms of maintaining our emergency department services, other acute medical and surgical services as well. Today we have, pleasingly, we've had a pretty significant reduction in the number of staff that are furloughed. We're back down to 61. So in the last few days we've had a reduction of around about 100 staff that were furloughed, and we're really pleasingly, and I'm really grateful for GV Health staff, particularly those who are in as close contacts that are now able to return to work under certain circumstances. That's really allowing us to continue to do and provide the services that we do, and for those staff to support their colleagues. So I'll leave it there and happy to take any questions.
Can you give us some more details about which services are shut as a result of the Code Brown?
Primarily it's in our community health area, so some of the clinical services that we would provide for people who coming in, they might be recovering post surgery in terms of some rehabilitation work. Our dental clinic is taking emergency patients only at this stage. And then some of the other areas are like what I touched on before. We do have staff who have clinical or health related qualifications working in, say, our quality teams or our education teams, we've pulled right back on those services and redeployed. But they're mostly the community or primary care type services that we've temporarily closed and redeployed people into the ED or the acute based services.
And how long do you expect the code brown to last?
So the Department of Health have flagged a 4 to 6 week period from yesterday. So, but I did hear Brett Sutton talking about where the case numbers were placed from a community point of view in terms of the active cases. So they are starting to decline. So as I said before, this is the third day in a row for us, for our local public health unit. We've had in the order of the mid 200 new cases diagnosed. We do know that there's usually a period of around about 7 to 10 days, maybe up to 2 weeks, where the hospitalisation still will occur from when you have the peak in case numbers. And as of this morning, we're at probably one of the higher points we've had throughout COVID in terms of the number of people that are admitted. So we're certainly seeing and experiencing that ourselves at the moment from a GV Health perspective. So it'll be something to monitor in terms of the case numbers may come down in terms of what we're reporting, but the pressure on the hospital systems and the more broader health system will persist for a few weeks after that, and indeed, many months to come while we try and recover from the pandemic and where we're in the place where we're at this stage.
Just one question about spring now. So are you concerned that we will see another little spike in cases this weekend with the amount of people that are attending?
It's quite possible that there will be a spike in cases for spring nats and other community events and things that are going to be happening, in coming weeks. I would just encourage people to not lose sight and remember to do all of those little things like wear masks, keep your distance, sanitise. They all make a difference. And of course, if people are eligible for their boosters, we want people to get their boosters as quickly as possible. So book an appointment to get that done. I think those events you do see higher rates of transmission at those events, but as far as I understand, they're complying with the current guidelines and requirements issued by the Department of Health and the government. And but still, as individuals that attend those events, I think it's really important and that people do keep that in mind and do the right thing.
Okay.
Good.
Thank you.
Thanks.
Awesome. Thank you.